Well, on this issue, I spoke a little earlier to Professor Sheila Tlou, who's the co-chair of the Global Campaign and HIV Prevention Coalition. Professor, let's start with the theme this year, Rock the Ribbon, here in South Africa. What does that mean?
We'll talk about the global one later. But you've asked me about the South African one. It's saying rock the ribbon. And it is really also a call to end inequalities, to say, look, we have the science, but we still have barriers that prevent us from reaching the global targets, especially the recent ones which were agreed on last year, the 2025 one. So what is it that we can be able to do? And it's really saying, let's not forget that AIDS is still not over. We have a lot of work to do. And yes, there is a light at the end of the tunnel, but we can either turn it into success or an oncoming train. So it's really that. It calls for collective responsibility. Responsibility by our leaders, responsibility and accountability by civil society, by everybody, so that we can reach those targets.
And I suppose it ties into the global theme, doesn't it? Talk to us about that too.
Yes, the global theme is equalize. It is actually a call to action to end all inequalities that hinder progress and progress that has been made in the AIDS response, specifically influencing access to HIV prevention services and choices. It is basically saying we have made progress, but we need to turn the tap if we're ever going to see the end of AIDS by 2030. Yes.
So what would you say is hindering progress? What inequalities are there that are hindering progress in HIV prevention?
Okay, for now, we are looking at the fact that our goal as the Global HIV Prevention Coalition was to decrease, to have less than 370,000 new infections annually by 2025, meaning that we don't want more than 370,000. We should be less than that. But we are actually not, but for us to be able to achieve that, we need to overcome 4 big barriers. And that's what really we're focusing on right now. One has been limited political leadership, limited investment in terms of especially domestic investment into the AIDS response, policy barriers, and lack of implementation at scales. So we are seeing in, for example, 10 African countries. Let me name them so that they, when they're listening to this, they get sort of inspired. We have Cameroon, we have Cote d'Ivoire, DRC, Eswatini, Ethiopia, Kenya, Lesotho, Malawi, South Africa, and Zimbabwe. New infections actually declined by 50 to 70% between 2010 and 2021. So that we've seen that they did this through a combination of increasing access to treatment for HIV while achieving that increased coverage of effective HIV prevention services, such as condom use, voluntary medical male circumcision, combination prevention for key populations, and also looking at adults and girls and young women. And we're saying if these countries continue doing what they're doing, as well as removing the policy barriers, they actually will be able to reach those 2025 targets. So you are calling upon, therefore, other countries to be able to just do that and ensure that there is coverage, equity in coverage. So we are calling on this World AIDS Day for all countries to provide HIV services for all people, regardless of where they are. Yes.
Services talk to treatment, perhaps, and keeping CD4 counts, etc., down. Yes. Prevention largely is about not getting it in the first instance. Now, yes, we know how you contract HIV. Why is it that people are still contracting it? Because I can't believe that there are still people who have no idea about the virus and how to get it.
Well, there are still barriers. For example, if you look at adolescent girls and young women, they are really the most affected. Last year, in 2021, an adolescent girl or a young woman was being infected with HIV every 2 minutes. Yet we had countries that still had laws that were barriers to pre-exposure prophylaxis, barriers to use because of consent laws. So that you find that where even these girls and young women are trying by all means to get access to some of the prevention services, there are barriers, the laws that prohibit access. And so that's why this World AIDS Day, we are calling on all our leaders to not only guarantee sexual and reproductive health and rights for adolescent girls and young women, but also to remove those age consent laws that leave adolescents and at greater risk of HIV. So that's basically that, where you have a young girl who may be sexually active, but then she is told, no, you are underage, there's no way we are going to give you condoms. You are underage, we can't give you PrEP. Yet, the very fact that she is asking for help means that she is actually sexually active and needs that help. Yes.
Why are young girls and adolescent women, adolescent girls more vulnerable to HIV? Are they having sex with much older men? Because I think that an equal number of young men would be HIV positive then.
Reports even right now from Caprisa, Croatia was just talking about that, where you have sexual liaisons between young girls and older men whose chances of being infected are actually greater. But the point is that, we do have to make sure that we engage also men and boys. They are a critical factor in our efforts, in that even when we are saying there are dangerous inequalities, we need to ensure that everybody is aware of their equal rights, of their being accountable, and to not take advantage. Definitely, a young woman who is economically dependent would not be able to negotiate or safer sex, let alone refuse and face safe sex. So that we are looking at that, not only that to make sure that we keep girls in school with skilling, and we make sure that they are economically independent. That way, at least they can be able to negotiate on a much more equal scale than if they were completely dependent on their partner. So it's basically that.
So access to drugs is a good thing, but I wonder if it doesn't come with people perhaps saying, it's not serious if I get HIV because there are drugs now, and that then relaxes our behavior once again.
Well, basically, access to drugs is great, and we have been able to show that treatment is prevention. But as you are saying, if we are going to really curb the tide of new infections, we then need to have more and more robust prevention services rather than access to drugs, because we cannot treat ourselves out of an epidemic. That one is certain. We need to prevent. That way, we can be able to use that money for other developments at country level, rather than pouring them all in the AIDS response. And as you are well aware right now, even at country level, there is very little funding that is now being given to HIV and AIDS. And we are calling upon governments to say it's accountability. We need to increase the funding, especially domestic funding of HIV and AIDS at country level. Yeah.
I know COVID-19 knocked us back quite a bit in terms of fighting the HIV pandemic. I wonder if we can get back quickly to the gains that we were making before the pandemic, the COVID-19 pandemic.
We can. In fact, that's why when we're saying dangerous inequalities and we're looking at those very 4 barriers, to say this, we can now get back if we look at even removing the policy barriers, making sure that key populations also have access. So the inequities in access are also, dangerous. We need to ensure that everybody has equal rights in terms of prevention services. For example, we are now calling upon countries to say prisoners should have access to preventative services. So people in incarcerated areas should be able to be reached and treated just as other people in the community. It's basically that. If we do that, we will be able to get back to where we had a lot of gains. Now, 50 to 70% drop in new infections is no mean feat, and we need to keep it up. Yes.
Prof, you've been at this for nearly 4 decades now. How much progress would you say we've made over time in fighting HIV, preventing it, treating it? And are you hopeful that there will come a time in the near future that there will be no more HIV in the world?
It is my belief, having lived the AIDS response since 1985, and actually being interested in it as a young girl when I didn't even know anybody who was infected, and going through seeing the devastation that it caused, and becoming a minister and actually participating in getting rid of a lot of the deaths in my own country, Botswana, becoming regional director and supporting 24 countries to be able to bring down the epidemic. I will say I definitely have lived that hope, and I know that in my lifetime, I will see the end of HIV, but it simply means that we have to work hard with our countries. We have to ensure that our leaders invest in the AIDS response. We have to ensure that, key populations are also taken care of. And most important, we need to focus on the men and the boys. They are critical in our efforts to end AIDS. So I really, as in my remaining years of life, and I'm turning 70 next year, I'm hoping that I will see the end of HIV before I finally leave. Yes.
Professor Sheila Tlou, co-chair, Global HIV Prevention Coalition, thank you very, very much indeed for joining us on the program today. Thank you so much for the work that you do.
Thank you very much. And thank you to everybody. All I can say is that let's end the dangerous inequities, the dangerous inequalities, and we will see the end of HIV in our lives.